Every 40 seconds, someone experiences a stroke. But here's what terrifies me most as a doctor. Many of those strokes, many of those cases of dementia, many of those instances of rapid cognitive decline, they're not inevitable. They're not genetic. They're not the natural consequence of aging. They're caused by medications prescribed by doctors sitting in medicine cabinets right now. Millions of seniors are taking 9 specific medications every single day, trusting that these pills will help them live longer and healthier. But what if those same medications are silently erasing their memories, destroying their ability to think clearly, and accelerating cognitive decline faster than any disease could? Today, I'm revealing the 9 most commonly prescribed medications linked to dementia-like symptoms in seniors. And by the time we reach medication number 5, you're going to realize it's in your own medicine cabinet or your loved one's. I'm Dr. William. This is the most critical warning I can give you about protecting your brain. Cognitive decline is the #1 fear among seniors. Not heart disease, not cancer, the fear of losing your mind, losing your independence, losing yourself. And it's this terror that makes dementia so devastating. Because when you're told you have Alzheimer's, you feel helpless. You feel like your future is written. But here's the truth that most doctors won't tell you. Up to 30% of cognitive decline in seniors isn't dementia at all. It's medication-induced. It's reversible. A 72-year-old woman in Ohio started Xanax for anxiety and began losing her memory within weeks. Her family prepared for early Alzheimer's, but when her medications were adjusted, her memory returned completely. A 76-year-old man on Benadryl every night woke up confused every morning, losing years to what felt like early dementia. Switching to melatonin and sleep hygiene restored his clarity within weeks. These aren't rare cases. They're happening to millions of seniors right now, and almost nobody is making the connection between their medications and their cognitive decline. You deserve to know this. Your brain is too precious to risk on information your doctor might not have time to share in a 15-minute appointment. I'm Dr. William. Over 2 decades, I've worked with elderly patients experiencing cognitive decline. I've reviewed hundreds of peer-reviewed studies in journals like JAMA Neurology, the Journal of Alzheimer's Disease, and the American Journal of Geriatric Psychiatry. I've watched seniors regain their mental clarity when problematic medications are identified and adjusted. And I've seen the heartbreak when cognitive decline is blamed on genetics or aging when actually it could have been prevented. Everything I'm sharing is grounded in science, not speculation, not fear-mongering. I have no financial interest in whether you take or don't take these medications. My only goal is to give you the truth so you can make informed decisions with your doctor. Let's begin. Benzodiazepines are prescribed for anxiety and sleep. In the short term, they work. But in seniors taking them long term, they're devastating to cognition. Here's why. Benzodiazepines enhance GABA, a calming neurotransmitter. But in aging brains, they accumulate to toxic levels because elderly bodies metabolize them slowly. They suppress neuroplasticity, your brain's ability to form new memories. They increase neuroinflammation and disrupt the glymphatic system that clears toxic proteins associated with Alzheimer's. A landmark study in JAMA Neurology followed over 3,400 seniors for 8 years. Those taking benzodiazepines had a 50% increased risk of developing dementia. 50%. I had a patient, Margaret, 76, on Xanax for 13 years. She was losing her memory, her grandchildren's names fading. Her family prepared for Alzheimer's. But when we carefully tapered the benzodiazepine and replaced it with buspirone and cognitive behavioral therapy, something remarkable happened. Her memory returned. Within a year, she was sharper than she'd been in years. The decline wasn't inevitable, it was medication-induced, and it was reversible. If you're on a benzodiazepine long-term, please talk to your doctor about safer alternatives. Don't stop abruptly. Withdrawal can be serious, but discuss a transition plan. This is where it gets scary. Anticholinergics are everywhere, and most people don't even know they're taking them. They're in over-the-counter sleep aids, allergy medications, bladder medications, some antidepressants. And they're devastating to memory. Anticholinergics block acetylcholine, the neurotransmitter absolutely critical for forming new memories. When you block acetylcholine, you're literally blocking memory formation. It's like trying to record a video with the camera off. Additionally, anticholinergics accumulate in elderly bodies because kidney function declines with age. A study from Indiana University followed over 3,000 seniors for 7 years. Those with high anticholinergic burden had a 46% increased risk of dementia. I had a patient, Dorothy, 72, taking Benadryl for sleep, Ditropan for bladder issues, and an antihistamine for allergies. 3 anticholinergic medications simultaneously. Her memory was failing. Her family was devastated. When we systematically replaced each with safer alternatives, melatonin instead of Benadryl, pelvic floor physical therapy instead of Ditropan, non-drowsy antihistamines, something incredible happened. Within 2 months, her memory was returning. Within 3 months, she was sharp. All from simply identifying and removing anticholinergic medications. If you're taking any anticholinergic medication, ask your doctor about your total anticholinergic burden and safer alternatives. Sleeping pills suppress REM sleep, the stage when your brain consolidates memories and clears metabolic waste. Every night on a sleeping pill is a night your brain isn't doing its most critical restorative work. Additionally, these medications accumulate. Ambien's half-life is 2.5 hours in younger people, but 10 hours or longer in elderly people. So you're waking with last night's medication still in your system, adding new medication on top of it. You're building up a toxic accumulation. Studies show that seniors on sleeping pills have higher cognitive decline, increased dementia risk, and morning cognitive impairment that persists throughout the day. I had a patient, Robert, 74, on Ambien for 8 years. He was foggy every morning, confused, slow. His wife noticed he seemed lost in conversations. When we tapered the Ambien and implemented sleep hygiene consistent schedule, no screens before bed, keeping the bedroom cool, warm chamomile tea, he woke up clearer than he'd been in years. Within a month, his wife said he was more present, more himself, all from stopping the medication that was damaging his sleep architecture. If you're on a sleeping pill every night, especially if you're over 70, please discuss with your doctor whether this is still necessary and what alternatives exist. I say this with deep compassion. Chronic pain is devastating, and opioids provide real relief. But the cognitive cost is something systematically ignored. Opioids suppress neural activity broadly throughout the brain. They cause neuroinflammation, chronic activation of brain immune cells, leading to ongoing neurological damage. They accelerate neurodegeneration. Studies show that seniors on long-term opioids have significantly worse cognitive function, higher dementia risk, and greater functional decline. Some research suggests long-term opioid use ages the brain by 10 years or more. I had a patient, James, 72, on OxyContin for 6 years for chronic back pain. Over that time, he'd become progressively more forgetful, less engaged, slower to respond. He felt like his mind was deteriorating. When we began careful opioid deprescribing while implementing multimodal pain management, physical therapy, non-opioid pain medications, mind-body approaches, his cognition improved dramatically. As the opioid burden decreased, his clarity returned, his memory sharpened, and his pain managed through multiple approaches rather than just opioids was actually better controlled. The cognitive decline he thought was inevitable from his pain condition was actually being caused by the treatment. If you're on long-term opioids, please talk to your pain specialist about deprescribing possibilities in multimodal pain management. Here's a medication almost nobody connects to cognitive decline: proton pump inhibitors. Tens of millions of people take them for acid reflux. They're supposed to be short-term, but most people take them indefinitely. And that's where the problem begins. PP is reduced stomach acid, which impairs vitamin B12 absorption. Over time, B12 deficiency develops, and B12 is absolutely critical for brain health. B12 deficiency causes cognitive decline, memory problems, confusion, and permanent neurological damage if severe. Studies show that long-term PPI users have a 44% increased risk of dementia compared to non-users. One study found that PPI users had significantly lower B12 levels and worse cognitive function. I had a patient, Frank, 71, on Nexium for 12 years. Over 3 years, his memory declined, his concentration suffered. His doctor attributed it to aging. But when we checked his B12 level, it was critically low. Despite 12 years of PPI use, his doctor had never checked it. We started B12 supplementation and carefully tapered the PPI. addressing his reflux through dietary changes and lifestyle modifications. Over 6 months, his B12 normalized, and his cognitive function returned. He went from feeling like his mind was deteriorating to feeling sharp and clear again. If you've been on a PPI for more than a few months, ask your doctor about your B12 level and whether you could try deprescribing. Now let me quickly cover 4 more medications linked to cognitive decline. Medication statins. These cholesterol-lowering drugs are prescribed to millions, but cholesterol is critical for brain function. Your brain is 25% cholesterol. Statins deplete CoQ10, crucial for mitochondrial function. Several studies link statin use to cognitive decline, particularly in those over 75. If you're on statins and experiencing cognitive changes, discuss with your cardiologist whether a lower dose or CoQ10 supplementation might help. Anticholinergic antidepressants. Older tricyclic antidepressants like amitriptyline have strong anticholinergic properties devastating to elderly brains, yet they're still widely prescribed, often because they're cheaper. When seniors switch to SSRIs with lower anticholinergic burden, cognitive function often improves dramatically. Ask your psychiatrist about alternatives. Medication, blood pressure medications. While generally safe, some research suggests ACE inhibitors and ARBs may affect cognition in some elderly individuals through altered cerebral blood flow or other mechanisms. If you're on these medications and experiencing cognitive changes, discuss with your cardiologist. A dose adjustment or medication switch might help. Medication corticosteroids. Prednisone and other corticosteroids are powerful life-saving medications for serious inflammatory conditions, but they suppress neurogenesis in the hippocampus and promote neuroinflammation. Seniors on corticosteroids show measurable cognitive decline. Even short courses can cause temporary but significant cognitive impairment. Work with your doctor to use the lowest effective dose for the shortest time necessary. Here's something even more dangerous than any single medication: taking multiple medications simultaneously. The typical senior takes 5 to 9 medications. Some take 15 or more. Each individual medication might be prescribed for a specific reason, but the combined effect on cognition can be catastrophic. Drug interactions are complex. One medication might inhibit the metabolism of another, causing it to accumulate to toxic levels. And with declining kidney and liver function in elderly bodies, medications don't clear efficiently. They build up. I had a patient, Dorothy, 79, on 11 different medications. When a geriatric pharmacist reviewed her complete list, we realized she had 4 medications with anticholinergic properties, 3 with sedating properties, and a complex web of interactions. Her cumulative cognitive burden was astronomical. We carefully deprescribed several medications, removing those that were redundant or no longer necessary. We switched some to safer alternatives. Within 3 months, her cognitive function improved so dramatically that her daughter didn't recognize her. She went from confused and foggy to sharp and engaged. The improvement came not from adding something new, but from removing the toxic medication burden. If you're taking more than 5 medications regularly, please ask your doctor or a geriatric pharmacist to do a comprehensive medication review. Ask which are still necessary. Ask about interactions. Ask about deprescribing opportunities. So how do you know if medication is causing cognitive decline? Watch for these warning signs: sudden or rapid onset. If your memory declines suddenly after starting a new medication, that's a red flag. Normal aging is gradual. Medication effects can be immediate. Multiple cognitive domains affected. If you're experiencing not just memory problems, but also difficulty concentrating, slurred speech, and confusion, all starting around a medication change that suggests medication-induced impairment. Morning fogginess. If you're waking up confused, particularly corresponding with a new medication that suggests residual drug effects. Difficulty with familiar tasks. If you're suddenly struggling with things you've done 1,000 times: cooking, navigating, managing finances, something has changed acutely. Mood changes. If your personality has shifted more irritable, depressed, or anxious than baseline, that can indicate medication effects. If you're noticing any of these symptoms and they correlate with starting a medication or increasing a dose, talk to your doctor immediately. Don't accept it as normal aging. Document when symptoms started and what medication changes occurred. That information is invaluable. Don't panic. Don't stop medications abruptly that can be dangerous. Instead, here's the safe path forward. Step 1. Document your medications and cognitive timeline. Write down each medication when you started it and cognitive changes you've noticed, noting when they began. Step 2. Have an honest conversation with your doctor. Bring your documentation. Ask specifically about each medication's cognitive effects. Ask about your anticholinergic burden. Ask about alternatives and deprescribing opportunities. Step 3. Consider a medication review with a geriatric pharmacist. Many pharmacies have pharmacists specializing in senior medication management. It's often free or low cost and invaluable. Step 4. Explore non-pharmacological options. Cognitive behavioral therapy for anxiety and insomnia, physical therapy for pain, exercise and meditation for stress. Step 5. If deep prescribing is appropriate, do it carefully with your doctor. Taper slowly. Don't stop cold turkey. Monitor yourself during changes. Step 6. Follow up regularly. Your cognitive function might improve gradually over weeks or months. That improvement is the goal. You have agency here. You can work collaboratively with your healthcare team to protect your cognitive health while still treating the conditions that need treatment. Have you experienced cognitive changes after starting a medication? Have you improved after stopping or changing one? Drop your story in the comments. I read every single comment. What medication concerns you? Ask me. Your voice matters. Your experience might help someone else. Share this video with someone you care about. It could protect their memory and independence. You've learned about 9 medications linked to cognitive decline. Benzodiazepines, anticholinergics, sleeping pills, opioids, proton pump inhibitors, statins, anticholinergic antidepressants, blood pressure medications, and corticosteroids, plus the critical danger of polypharmacy. You now have knowledge that could protect your brain and your future, but here's what's most important. You are not powerless. Your cognitive decline is not inevitable. With informed decision-making and honest conversations with your healthcare providers, you can protect and even recover your cognitive function. Critical disclaimer: everything here is for educational purposes only. Do not stop taking any medication without consulting your physician. Some are life-saving. Always consult your licensed healthcare provider before making medication changes. If you experience serious side effects, contact emergency services immediately. If you want evidence-based senior health content every single day, subscribe now and turn on notifications. I'm Dr. William. My mission is to help you protect your cognitive future. Thank you for watching. You are worth the effort.